Welcome to another episode of the Wealthy Podcast, and today you are getting Shauna Nairo's Sans glasses. For those of you that are watching this on YouTube, yes, these are my naked eyes. I'm very excited. I got contact lenses yesterday. They're working like a charm, and it's such good timing because today we're welcoming an optometrist onto the Wealthy Podcast, Dr. Sophia Capo. She is an optometrist. She owns ABC Optometry and Vision here in Kelowna. She's on the UBC Faculty of Medicine, and she also is the founder of the We See BC Foundation to help people with financial challenges who need optometry services get the services they need. She is an amazing storyteller. She's a wonderful human being. She is a wealth of knowledge on all things optometry. She has a specialty in pediatric optometry and post-concussion vision care. This is an episode for everyone because as far as I can tell, we all have eyes and our eye health is so important. Listen up. As an optometrist with additional training in pediatrics and the founder of ABC Optometry and Vision Therapy in Kelowna, Dr. Capo is helping children and adults rediscover clarity, confidence, and connection through something many of us rarely think about. Her work is as much about healing as it is about seeing. From early childhood development to post-concussion rehab, Dr. Capo helps patients move from struggle to strength, not just by correcting vision, but by helping them feel truly seen. Dr. Capo is also the founder of the We See BC Foundation, which we're going to talk about. And this episode is truly about more than just eye care. It's about the power of perspective and how we look at the world and how we look at ourselves. So let's get at it with Dr. Sophia Capo. May I call you Sophia?
Yeah, absolutely.
Amazing. Welcome to the Wealthy Podcast.
Thank you so much for having me.
It's great to have you. So we have a bit of an opening tradition on the Wealthy Podcast because we're curious and because this is all about health, and everybody that sits in that chair comes with some sort of passion or dream or vision or belief about changing the world when it comes to healthcare. Where did that come from for you? Where did this start? Where did your path start, and how did you get here?
I think it's really interesting because my path actually started in education. So I was really interested in teaching and in learning myself. As a kid, my first jobs were soccer referee. But at that age, when you're reffing the little kids, it's mostly about teaching them the game. And then I was a swimming instructor for many, many years. And I taught children with diverse needs. I taught adult swim classes. I taught even the parent and taught. You remember those? Yeah. Singing and dancing classes. And then in undergrad,
that takes a special human too.
Oh, it was fun. You got to really get over the embarrassment of singing really quickly. But then in my undergrad, I was actually in the concurrent education program. So I was on my way to becoming a teacher, and I wanted to teach high school math and science. Those were the subjects, I guess, that I felt like I was most connected to. I really enjoyed like math, chemistry, physics, more of like the mathy sciences. Mm-hmm. And then when I was around 15, I got my first migraine, and my migraine came with a visual aura, which is essentially visual disturbances. Some people describe them as a kaleidoscope, or in my case, it's kind of like missing pieces from my vision. And it's incredibly scary when it first happens because you have no idea like why. It feels like your brain is, or your eyes aren't working. And it was actually my eye doctor, my optometrist, who told me what it was, checked my eyes to make sure there wasn't a problem, sent me to the correct practitioner to get treatment for it. And in that, I realized that, doctors are educators too. Mm-hmm. And I said, well, why don't I take my passion for teaching and learning and turn that into educating others? And so I kind of brought that full circle. Like I took what I love, which was education and learning. And then I took my passion for working with kids and working with the diverse needs populations and became an eye doctor with a little more training that helped me to excel in those areas.
That is so interesting. I have, I'm sure I'm not unique. I've experienced a few issues over the years with my eyes. I had an ocular migraine.
Okay.
Have you heard of that?
Yeah, so that's kind of what I'm talking about, like a visual aura before
Yeah.
migraine.
Yeah.
And ocular migraine is kind of another word for that.
But I didn't even have a headache. It was
Oh,
so
okay.
weird. It literally just came on. And I was sitting in a meeting here at the foundation and I'm like, I'm actually going blind in this moment.
And it's
Luckily-
scary.
Yes. Luckily, we're close to the emergency department. And the fellow that was there was a resident and he had them before. I also scratched my eye and went in and had the same kind of like experience in the ED. But at no point did I go, maybe I should go be an optometrist.
Fair.
Yeah. So like that's pretty amazing. And so then you sort of followed that path. You went through school. And how long does it take? We have a lot of like students that listen to the podcast.
Yeah.
How long did it take to get you through
Like all of that.
all of the things?
So an undergrad degree, I studied biomedical science at York University out east. I'm from just north of Toronto. It's 3 or 4 years. I finished in 3, and then I got into optometry school at the University of Waterloo. That's a 4-year program.
Right.
And then very uniquely, I did an additional year after that. So you don't have to, in optometry, do any additional years to practice like you do in medicine, like you have to do a residency. In optometry, residencies are optional, but they allow you to gain extra specialized training, extra expertise that kind of makes you more confident, more able to do what you want to do kind of faster.
Right.
So I went down to the US just because there's more availability of programs down there, just a wider variety of knowledge and understanding in the US. So I went down to Michigan and I did an additional year, and that's where I kind of specialized in pediatrics and then adults post-brain injury. So my clinic here in Kelowna really focuses on those demographics.
2 areas.
Yeah.
I have to say, I am just fascinated by the specialties that you've pursued, both as a parent and a parent of an athlete who is at high risk for concussion, and just being very aware of the side effects of a traumatic brain injury. And so I'm really excited to get into all of that with you today. I just want to ask you, just to kind of frame the conversation, who do you think will get the most benefit out of this episode?
Well, I think everyone has eyes. So the thing,
Good answer.
Most people, I guess.
If you have eyes, you will get a benefit.
Yeah, for sure. But mostly if you have an interest in seeing how vision is a lot more than just seeing clearly. So I think that a lot of people associate vision with 20/20.
Right.
But we don't understand, sometimes we don't remember that vision is a whole lot more than that. And so sometimes when we open those doors and we expand that mindset, we learn, no way, like this is actually way bigger than I thought it was. And if I asked you, of the 5 senses, whatever, like hearing, seeing,
smelling, tasting, touching.
There you go. Of those 5, if I said you have to give me all of them except for one, which one are you keeping?
Well, I feel like obviously I'm going to say vision, but I would say that.
So most people would say that vision is the dominant sense.
Yeah.
Right? We only get 2 eyes. They work together, but I guess they could also work separately if you lost one. But they're very important because we really only get 2. And the eyes actually come out of the brain during development. So it's made of like very similar tissue to the brain.
What? Like
so
they come out of the brain?
Yeah, like when we're developing in utero,
yes,
the eyes are made out of similar tissue that the brain is made out of, which is why like you can't do a brain transplant, you can't do an eye transplant either. If something goes wrong. So it's a very important organ, and we only get 2 of them. And we need to treat them that way. We need to treat them like they're very important, because sometimes you don't realize how important your vision is until you lose it.
100%. And actually, that is such a good segue, because I'm going to share with our audience that today is the first day since we started recording this podcast. This is a very big deal for me. And I find it so ironic that today is the first day I'm not wearing my glasses, because I got contacts yesterday because I'm old and I can't see. And so I was always like having to wear my glasses, but I'm in that funny age where I can still sort of see distant, but I can't see up close. So I was taking them off, putting them on, taking them off, putting them on. So annoying. So I got the contacts, and then I'm like sitting with you today. I find that just like awesome.
Yeah.
And it just really goes to show you, I totally empathize with what you're saying about how we take it for granted. I've had 20/20 vision my entire life. And then all of a sudden, as we age and as those muscles kind of like degenerate and you realize I can't see, it becomes a huge source of anxiety.
Yeah.
Like
sure.
I was always like in my purse, there's like 3 sets of reading glasses and then I have another stashed over here and 2 in my car. And like, because you literally are pretty useless without that sense of sight, especially in today's day and age where we're so screen oriented.
Yeah. And you'd be surprised. I just came back last month from a mission trip in Cambodia where we were doing some eye care there in a few villages that had never had eye care before. And in doing some of the research going through to look into that trip, the number one cause of visual impairment worldwide used to be like cataracts. Now it's actually near blurry vision due to just not having reading glasses.
Really?
Is actually one of the number one reasons for people being visual impaired worldwide. Something we take for granted, like you can get cheater readers at Costco at the dollar store.
Oh, totally.
Is actually one of the main reasons why people worldwide can't see.
Okay, I'm going to double click on that because I find that so interesting. Yeah. So basically, what do you think is causing that? Like, is it lack of access to reading glasses, or the need to be able to see up close now is just more prevalent than it was, say, 30 years ago, 50 years ago?
We don't realize, like right now, obviously, you mean like, are we on digital devices? Like, are we looking at a phone? People worldwide, are they doing that more?
Exactly. Like our habits in North America, I feel like are a little
definitely
over the top.
Changing,
yeah,
for sure. Worldwide though, think about it even as like trying to eat or trying to cook and being able to cut.
Yeah.
So I think these problems were there for a long time. It's just we're finally getting data now,
right?
On
good
these
data.
Smaller communities that before we weren't even able to really look at.
Wow. What a gift that you're giving these people. I can say, and I know that I'm not alone. Like I know there's people listening to this going, oh my gosh, that first time that you put on reading glasses and you're like, oh my gosh, I didn't realize how bad it's gotten. Yeah.
Yeah.
Can you help me understand or help our audience understand, like, you said something like it's not just 20/20. Vision is so much deeper. Excuse me. How does vision impact movement? I know this is a big question. Excuse me, cognition and like our emotional well-being.
So I'm just going to start by attacking that 20/20 bit. So 20/20 just means that from 20 feet away, you can see what the average person can see from 20 feet away. So someone who has worse than 20/20 vision, for example, let's say you can see 20/50, a bigger letters on the chart.
Yeah.
That means that from 20 feet away, a regular person standing 20 feet, you have to stand 20 feet away, but the average person can actually see it from 50 feet away. So the average person can stand further away. You need to stand at 20 feet in order to see something that's 20/50.
I see.
So your vision is worse. Essentially, you have to stand closer in order to see it.
So the bigger the number on the bottom, like I don't want to say worse. It sounds like a judgment.
Yeah, it is.
But the worse your close-up vision is.
We have a measurement for close-up and for far away.
Okay.
So in that case, it would just be like, for example, you can have 20/20 vision far away, and then 20/20 vision up close, but 20 technically means 20 feet. So we use it like that because that's what the layperson can understand. But we have different metrics for measuring vision up close.
So that's where somebody could be like 20/10.
20/10 would actually be better than
you're like a
20/20
superhuman.
vision. Yeah. So what the average person can see from 10 feet away, you can actually see from 20 feet away is what that means.
Okay.
So you could stand further away.
Cool.
But think about vision as even being a form of confidence. So if you can see very clearly, and not necessarily even clearly, but single vision, and your focusing system works properly, like you're saying, you were describing your focusing system and as you got older and how it got worse, that can affect how you feel about yourself or how you perform at work or at school, in terms of, I can see, I can excel at my work. Mm-hmm. There's children, for example, who are born with genetic conditions who can't see well at all, We call this low vision. So it's not necessarily blindness. Blindness would mean no vision at all. Low vision is the term for, reduced vision. And that could really affect our quality of life, our self-esteem, our ability to participate fully in our activities and in our society.
Or like even sports.
In sports.
Yeah.
So there's a ton of implication there behind vision. And it doesn't even necessarily have to be even a measure of clarity or double. It can even be your visual field. So something like glaucoma, we call the silent thief of sight, because you don't know that you have it until it's basically too far gone, unless you have your routine checks. But glaucoma takes away your peripheral vision first. So it's essentially by the end, let's say you have really bad glaucoma, it's like you're looking through straws. So you can have 20/20 vision and see the 20/20 letter through that straw, but it's not very good.
Right.
Because mobility wise, you're going to be bumping into a lot of things.
Right. Okay. So that peripheral vision is really important for like,
Everything.
again, like what do you call it? Proprioception? Like not
moving,
banging into things.
You can imagine
tripping over
driving.
Stuff. Yeah.
Like driving requirements here
Yeah.
in BC, there's a clarity component, but also a visual field component as well.
Wow. So, as we've sort of been alluding to, it is a very overlooked area of our health. I think we only sort of start to get red flags if something is not working correctly. I found this stat according to the Canadian I should practice these. Help me.
That's okay. Ophthalmological Society.
Ophthalmological Society. That's a big one. I'll get it by the end of this. According to the Canadian Ophthalmological Society,
Nailed it.
75% of vision loss is preventable or treatable. Yet many of us delay or skip eye exams because we think, I can see fine. Everything's good. I don't need an eye exam. What are we missing?
I think we have to divide that what are we missing into adults and kids.
Okay.
In the adult aspect, I think we need to think about eyes like we think about the dentist. Because whether you have a toothache or not, you're going to the dentist and you're getting your teeth clean, you're getting your x-rays, and you're making sure that your oral hygiene is there. Why don't we think the same way about our vision?
I don't know.
I have no idea either. I have some ideas.
That's a good point.
We can talk about it. I have some ideas. But we need to think about our vision because like we said, like if you lose an eye, it's way worse than losing a tooth.
Totally.
But we go for routine care at the dentist. So why don't we go for routine care at the eye doctor? The eyes can be a whole lot more of a tell than just for reduced clarity. You can have 20/20 vision, but have diabetic changes in the eye or hypertensive changes in the eye. You can have 20/20 vision with both eyes open and not even realize that one of your eyes is a little bit blurry and that you might have signs of swelling in the brain. Or reduced color vision in one eye, which can give us tells about neurological conditions. So there's all these things that we can have that we wouldn't know if we don't check. In adults. In kids, I think we have more of a responsibility because kids don't know that they can't see.
That's right. They don't know what they don't know.
Exactly.
Yeah.
Adults, you would assume that if something was wrong, they would be able to tell you. And so even
or changed.
Yes.
Yeah.
Yeah, exactly. Especially if something changed. But kids oftentimes won't give us the same clue. So, for example, I had a 10-year-old just last week who came in having headaches and had seen all of these doctors for headaches, had gone for like MRI, couldn't find anything, unsure why he's getting all of these headaches. And someone had just said, why don't you go get your eyes checked? So I'm looking at him, I'm doing my testing, and he looks like he has a really wide eye posture. We can talk about what that means after, but I just asked the child.
So many things I want to ask.
So many things. I'm sorry. I asked the child, I was just like, do you ever see two of things when there's only supposed to be one? Like, does that ever happen?
Yeah.
And he's like, yeah, all the time. Like, just matter of fact, didn't even like hesitate to answer the question. Just like, yeah, it always happens. And of course, like his parents who are with me are just like, oh my goodness, why have you not told us that? And it's just, he didn't know that he wasn't supposed to see two.
Right.
Sometimes. And the dad's there like, oh my goodness, sometimes when he's playing the piano, like he double plays the notes. We didn't even realize. And so we were able to work through that. We were able to do a program with him to fix his double vision. And so last week is when I saw him for his like final.
Yeah.
and no headaches, and he's doing great in school.
So what was the fix for that? Glasses.
So we do a rehab program when there's a double vision issue if they qualify for it. So it's essentially like physiotherapy for the eyes.
Oh, okay.
And we're teaching the eyes and the brain to work better together, to coordinate better together.
Right.
Yeah,
so it's like exercises.
It's essentially exercises for the eyes. Yeah, and if you're a candidate for it, like there's some conditions that we can't fix with eye exercises.
Yeah.
But there's some that we can, and he fortunately had one that we could fix, and easy.
I love that story.
But it just goes to show that kids don't know that they can't see.
Yeah.
Kids don't know that one eye can see and one eye can't. That's happened so many times too. You get a kid cover one of their eyes, so they cover with their paddle, and they're like, "Oh, but that's my bad eye." Like, you never told your mom that you have one bad eye and one good eye? But they know. Yeah. That's why it's funny. Like, they know, but they just don't think it's relevant to tell someone that it's bad.
Or nobody's asked them.
Or nobody's asked.
Yeah.
But then I do like all this education, right? Because that's really important to me, to go out into the community and to tell people like, this is why we should be doing it. Because there's so many eye conditions in kids, like lazy eyes, eye turns, those types of things, which have, I mean, I guess a little bit to do with clarity, but also to do with eye coordination.
Mm-hmm.
And they're way easier to fix if we find them earlier.
Right.
But when I go out and I do these education events, sometimes like I'll see families, like let's say I'm at a booth at like a mom event or something, and I'm just like, oh, hey, like those are two kids, like have they ever had an eye exam? And the parent will just say, oh, I'm like, no, their eyes are fine. I was like, well, how do you know?
Yeah.
You have absolutely
it's
no
like
idea.
It's like your teeth. It's the same thing.
Unless you check.
Yeah. Like everything might seem fine, but then you go to the dentist and
they do an x-ray, they find the inside. Yeah, exactly.
Yes. Oh, such great awareness.
Yeah.
I want to circle back. Oh my gosh. I literally want to circle back.
Okay, sorry.
So many things you just said that right there. But you did say, like, circling back to kind of like the adult scenario, right? And this idea that a lot of vision loss can be prevented, or at least give an indication of other conditions that might be present.
Yeah.
That is so interesting to me. And I was surprised to learn that. I actually, one of the first sort of like, when my vision started to get a little blurry and fuzzy, I learned that also changes in hormones can also impact your eyesight in a very significant way. But you mentioned like diabetes and high blood pressure and some neurological conditions. Yeah. So so really the eye is kind of like the window potentially to overall health, much like we talked to a dentist who was saying like your mouth health
also gives
oral
that
health.
Same, yeah.
Tell me more.
Because the eye comes out of the brain, like we talked about, it's made of the similar tissue as brain tissue. There are things that can go wrong with the eyes that give us intel for things that might be happening in the body. The blood vessels in the eye are actually the smallest blood vessels that we can see without like cutting somebody open. So sometimes things happen in the microvasculature and the smaller blood vessels first, which is why we can get a little bit of stronger intel to that.
I see.
Like you can get, if you have high cholesterol, you can get cholesterol spots that stain the front surface of your eyes. So there's just other health conditions as well that we can find if we come for routine checks.
So you could have a patient, is that what you call them? Clients, patients. Whatever, come into your office and have like, I don't know, like increased blood vessels in the eye, like
so new blood
like
vessel growth can be signs of like diabetic changes, or can be signs of other like blood abnormalities in the body. We can also get like all the neurological changes. So if someone has like MS, or we can see changes in eye coordination in Parkinson's, or we see, like a lot of the times they might not necessarily be the first thing, but they might help us complete the puzzle. So inflammation in the eye, like you said, inflammation can come in the form of dry eye. It can come in the form of inflammation on the inside of the eye. Any autoimmune condition. So think like MS, I guess, can be, is also kind of autoimmune, but think even like arthritis, or inflammatory bowel disease, or like those types of things can actually manifest as eye inflammation. So sometimes it just helps us to put things together, like sleep apnea. People with sleep apnea tend to have floppy eyelids.
Really?
Because the tissue is stretchier and softer. And so sometimes like people are like, oh yeah, I haven't been sleeping. And we go to flip their eyelids and we're like, oh, that flipped like really easily. Like, do you snore? So sometimes it just leads to more questions that can then give us more information. I don't think there's ever, like, we can never make a diagnosis.
I was going to
about
say, like, you're not
else.
going to diagnose somebody.
Yeah, unless we see like
arthritis,
rampant like diabetic retinopathy. We can be like, you need to go get that checked. But that doesn't usually happen here in Canada because people usually know, like, they have other signs of diabetes as well. But it's more like this is part of the puzzle. To helping you figure out what's going on. And
having those, like you said, like regular checkups would help to either like mitigate some of the side effects of some of those other chronic diseases or neurological conditions. Or at the same time, validate if somebody's like, well, I have this particular condition, but my eyes seem weird, right? Then you're like, they are weird. Like, there is something going on there.
Definitely.
Yeah.
Yeah. And it's different in adults and kids, because in kids, for example, if a kid has an autoimmune disease, we follow them every 3 months or every 6 months.
Right.
Whether they have symptoms or not, because they can't tell us properly if something's changing.
So the moral of the story is, folks, if you're an adult, you have agency. Go get your eyes checked. Okay, so you also mentioned eye posture.
Yeah, I'll explain. I can get into that a little bit better. Pretty simply. Think about everyone's eyes as having a posture similar to how we sometimes slouch, or like we can sit straight. Everyone's eyes have to do that as well. And that's just because, like, we have two eyes and they have to work together in order for us to have single vision, right? Because if our eyes worked and all pointed at different things, then we would see two, right? So our eyes have to point at the same thing. And then our brain says, oh yes, both of my eyes are pointing at the same thing. That's one thing. And it shows us a picture of one. So you can actually have like a slouchy eye posture. And what that means is that in order for your eyes to maintain alignment, your system has to do a lot of work. So just think about it as like the effort that you have to put in to keep your eyes straight.
Right, yeah.
So someone with a slouchier eye posture has to do more work to keep their eyes aligned and to maintain single vision. Okay. Now I'll give you an example of when someone's eye posture can go slouchy. For example, most common thing to happen after a concussion is that we get a slouchy eye posture up close. Wow. So it's not a clarity problem. It's not a health problem with the eyes. A lot of these people still see 20/20, but they get symptoms of like intermittent double vision, intermittent blurry vision. I can't read anymore. I'm skipping lines all the time when I'm reading. The words are
slouchy.
Yeah, like the words are moving when I'm reading because our eyes aren't staying perfectly aligned. And so this is happening. Things are kind of, each eye is seeing something different and it's moving around. Now, an adult who never had that problem and then now does, very easy for them to say, like, this is an issue. I can't read anymore. This is a problem.
Right.
But for kids, sometimes kids have that just randomly. And it's a lot more likely in kids who have autism or kids who have ADHD or kids with learning disabilities, more likely to just have a slouchy eye posture. Sometimes it can happen just by chance too. But those things in kids, they sometimes won't tell you that they see double or that things are moving around. They just struggle with reading or struggle with attention, and then have those things.
Can that be okay? So can it be sort of like a chicken and egg thing? My daughter is ADHD and she I'm allowed to disclose that. She struggled with reading, but she's not sort of the hyperactive thing. And I'm just thinking, as you're saying that, oh my gosh, full disclosure, I've never had her eyes checked. Maybe I did. Maybe she's really little. But anyway, could that possibly be why some kids might present with ADHD or ADD characteristics?
So, like ADD and ADHD are like separate complete diagnoses diagnosed by, psychology, clinical psychology, neuropsychology. And so if you think that someone might have that disorder, it's very important to get that checked by a professional who specializes in diagnosing those things. And it's always alongside a pediatrician as well. That's the group there. What I see the vision aspect as is more of removing a barrier and making sure that prior to getting a diagnosis, that the visual system is functioning properly. Because you can take that as like, let's say a child that has some ADHD. Maybe they can manage it if they weren't seeing double. Or maybe a child doesn't have ADHD, they just have double vision. And you fix that, and then we don't even need the assessment anymore.
Right.
So I think it's a very important piece of the puzzle to rule out prior to doing that, especially because a lot of the testing for learning disabilities and for ADHD is visual based.
Yes.
So if we're constantly like taking kids and making them do these visual tasks in order to diagnose them, shouldn't we make sure that they can see first before we do those tests?
Yes.
Because another aspect, and the second most common thing to be wrong after a concussion or be a dysfunction in a child with those conditions we talked about, is a focusing system dysfunction. Now, you understand that very well because you're at the age where the focusing system is starting to deteriorate. Now, that happens to everyone once they hit a certain age. And that's normal. That's why we need our cheater readers or your multifocal contacts.
Which are working very well.
Which are working very
so
well.
good.
But in the population that is a little bit younger, sometimes after a concussion or after some sort of a brain injury, we actually get a change in the focusing system prematurely. So it's like you are 25, but you have the focusing system of a 50-year-old now.
And is that a permanent change?
So sometimes we can rehab it.
Okay.
So like slouchy eye posture, we can usually take that into a therapy program and rehab it. But sometimes with a focusing system, we actually have to put a younger person into a pair of glasses, into a pair of reading glasses,
right.
like the grandparents,
or their parents,
and so it's a different type of treatment. But in that case, we're not giving them the glasses because it's blurry and they can't see. We're giving them those glasses so that the glasses do the work because their system can't. And similarly with those types of symptoms, like people will see that they're like intermittent blurry vision, or they get headaches when they try and read too much because their focusing system is trying so hard to stay on. And we don't even realize that those things are there, especially in kids who can't tell us
articulate
those things.
that. Yeah.
So that's why it's also very important to put drops in kids' eyes when they get their assessments. Have you had drops in your eyes before? Okay, so adult
like
drops,
those weird drops,
like the weird drops that make your
regular
vision blurry.
Yeah.
Those ones. So sometimes in adults we can skip the drops because we can say, you had the drops last year and I'm not worried about any retinal problems. We have a photo now that we can take to check the health a little bit better and monitor for progress. And you can decline it as an adult and say, you know what, yeah, I'm okay. But in kids, we actually use the drops in a different way. We don't use the drops to check health. We use the drops to check glasses prescription. And it's because kids have a really strong focusing system. So you have a deteriorating focusing system, unfortunately. I'm sorry, I keep bringing it up. You have a deteriorating focusing system, but kids have really, really strong focusing systems, meaning like that's why when we see kids, they can like hold stuff really, really close to their face and still see it because their system is able to turn on and work really hard in order to see stuff. Now, you can imagine then a child could actually have a glasses prescription and just turn on their really strong focusing system and cover it up. But what happens there is because their system is working really hard, every so often it might fail. So you might get a little bit of blurry vision, or you might get headaches because the system is working on overdrive all day. And we actually know from the research that kids who have these hidden prescriptions tend to read slower. They tend to have poorer vocabulary. And they just tend to do worse in school. So we should be dilating our children to check for prescription every single eye exam appointment.
And how frequently would you recommend those?
Every year.
Every year.
Yeah. Because things can change every year. And as we get older, our focusing system changes. Our eyes also change in terms of how they grow. And also our visual demands change. So it's kind of thinking about optimizing the person to where they are at, which is why as those things change, we need to change.
It's absolutely fascinating. And now I'm like, I can't even believe that like I haven't had my kids' eyesight ever checked. Like, have you, Arden? Yeah. Oh, yes. Arden's parents are teachers, so she gets her eyes checked every year because they're smart. Apparently, communications people are not as smart.
No, I don't think it's a matter of being like smart or not smart. I think it's just a lack of awareness and and education. And honestly, part of that is also a funding problem.
Yes.
Because optometry should be seen as primary care, right? And we have different types of primary care. That means you don't need a referral to go in and see them. So our family doctor is the best example of a primary care. Same thing with like urgent care, the emergency department, right? So optometrist should be who you think of the second you have a eye related thing. It should be there's an issue with my eyes. I should go see the eye doctor, the person who spent all of those years of school specifically studying eyes. But that includes things that aren't vision related. And that's where the disconnect happens, because people don't see optometry as being more than that's where I get my glasses and contacts.
Totally.
And so you get a scratch on the eye, that shouldn't go to the emergency department. That should go to your optometrist. You're going to go there and you're going to probably not wait nearly as long. And you're going to get seen by someone who has a ton of training in diagnosing and treating eye conditions.
So like, okay. Question then.
Yeah.
I was watering my plants one day and my tropical plant, and now I always wear now I always wear glasses when I do that, because I actually got poked in the eye by the thing, and I was like, ow. Okay, no big deal. Went to bed. Next day, woke up. Good. So I went to Emerge, and I learned actually that like that's actually like if you ever get poked in the eye with a plant or anything like organic like that, like go to the doctor right away. You're saying go to the optometrist.
Absolutely.
Okay.
Yeah, because the optometrist is not only more equipped to handle
because they'd probably do the same thing as they did with me.
Well,
and the ED or maybe better.
But just think about it as like all day, every day, we're using that equipment and doing things with eyes. So we're just a lot more proficient at doing those things. And we have all the things you need. And a lot of people don't realize this, but optometrists actually have the same access to eye surgeons that any other doctor does. And honestly, maybe even better access to them, because we can provide them with better information for triage. So if we send an equivalent referral, but we say, hey, I already checked and it's this, and this, that's way easier for the surgeon to then say, okay, well, I know exactly what I have to do, rather than coming from someone.
And then they have like a less of a sort of pre-op.
Exactly.
Yeah.
Exactly.
Yeah.
But that's where our funding issues come in, because if you go to the emergency department, that costs you $0.
Yeah.
But if you go to an optometrist, unfortunately, BC Medical doesn't give enough for an optometrist to not charge a copay. And it's just how it's been. The fees for optometry haven't changed in many, many years. And it's something that optometrists are constantly advocating for. But instead of completely removing themselves, kind of like dentistry did, where it's just like no government coverage, although there's some coming back now, but think about it that way. Optometry is kind of like a little bit. So the government says, okay, I'll give the optometrist $20 and then you have to pay $30.
Yeah. And hope that you have like an extended medical.
Yeah. And if you have extended medical, then that covers it. But for like an emergency or something like that, a same day emergency, if the optometrist is squeezing you in, let's say they have to make a referral or call someone or do a big thing. Like sometimes it might cost you $50-$60, right?
Yeah.
Which fortunately a lot of people may be able to pay, but unfortunately some people might not be. Right. So that's where we end up getting this kind of shared care, because there's a ton of eye things that end up in the emergency room that don't need to be there. There's a ton of eye things that end up at urgent care, walk-in clinics, those types of things
that don't need to be there.
That are like taking the time of doctors who
and
could potentially be using their skills.
And here's the thing, like time is, if we want to think about it this way, time is money. If you're spending, let's say, anywhere from 3 to 8 hours in the emergency department, that's, for some people that's time off work, like whatever it is, but it's just opportunity cost. Like it's 3 to 8 hours, you're not living your life.
Definitely.
And so if you're able to go and you have the capacity to pay it out of pocket, if you don't have extended, to go and see the optometrist, it's less time.
Way less
and maybe
time.
that's the trade-off.
Way less time and often the correct treatment pretty quickly.
And I do think that there's people out there that would do that trade-off, and again, like you said, it mitigates a lot of the congestion that we get in our emergency departments, right? Because always, every time I go to Emerge, there's somebody with an eye thing, like for sure.
Yeah. And some eye things definitely deserve to be there.
Yeah.
But from a triaging standpoint, optometrists do a really great job at getting you, even if you do need care that is above what optometry can do, getting you to the correct person faster, optometry can do that. Even if it's a neurological thing, like we also have access to neurology. We can contact them. We can contact ophthalmology. And get you the care that you need, oftentimes faster.
Amazing. Really, really good information. Okay, just circling back.
Yeah.
I found my other stat. I usually don't do a ton of stats.
Okay, that's okay.
But I have this one. Only 14% of children under 6 receive an eye exam in Canada. So I feel like I am part of the majority. That does not give us an excuse. But these rates are really low. And as you've already indicated, early detection in children's eye health is really vital. You've talked a little bit about child's confidence, like how vision impacts a kid's confidence and their ability to emotionally regulate. Also, just to like participate in the world as a kid, you know, play and jump and run and sports and all of that. So you mentioned like some common conditions that manifest very early on, like lazy eye, or there were some other ones that you mentioned. Do you want to just kind of like go through some of those?
Yeah. So a lazy eye is different from an eye turn. So sometimes when people think of a lazy eye, they picture an eye wandering.
Okay.
An eye wandering can also be a lazy eye, but the definition of a lazy eye is just an eye that does not see well, even with glasses on. And it doesn't see well because the eye and the brain didn't form the connection that it needs to form in order to see. And sometimes it doesn't form that connection because the eye is turned. Sometimes it doesn't form that connection because it has a glasses prescription that's significantly higher than the other eye. So you can imagine, let's say someone has 2 eyes that have very different prescriptions for glasses. The brain sees the eye with a much lower prescription and says, well, this one's way easier to see out of, so I'm only going to connect with this one.
Right.
And I'm not going to connect with the other one because that one is way too hard. And so it doesn't build that connection. Kids will not tell you that. And so that's a lazy eye. An eye turn is very easy to see and very noticeable. So parents who have a child who has an eye turn, they're usually like, hey, something's going on.
And does it turn like any which way?
It can turn in, out, up, down.
Okay.
Wherever
but
it
it's
wants.
always turned.
Only if it's an eye turn.
Yes.
Then it's a turned eye. A lazy eye does not necessarily have to
like
be
a
turned.
lazy eye. You could be talking to somebody and it just sort of like wanders away.
That would be an eye turn.
Eye turn.
Yes. A lazy eye is just an eye where the brain and the eye didn't make a connection. Because that could also be a prescription problem.
So most of the conditions that I maybe have thought of as lazy eye are actually wandering eye.
Yes.
What do you do for wandering eye? Is that rehab?
Well, think about wandering eye as like an eye coordination problem, right? So the 2 eyes are not connecting with the brain. They're not working together as a team. In some instances, we can correct those using a rehab program. So like in some instances, we can say, okay, let's train the eyes and the brain to work better together. Okay. In some instances, and usually it's because the eye turn is really, really large, that becomes a surgical case. But a lot of the times those surgical cases are cosmetic. So it's to make the eye look straighter. And that's because we have a lot of research suggesting that children with eye turns tend to get bullied more, which makes sense. Some other conditions besides lazy eye and eye turn, we can get slouchy eye posture, which we talked about. We can get focusing dysfunction. We can get reduced 3D vision. And then just all the other little things like scratched eye, sty, dry eye, pink eye. Like there's a ton of different types of pink eye that people don't understand either. The term pink eye essentially is just an eye that is a little red. That's what pink eye means when someone says, my kid has pink eye. Because you can get pink eye from a bacteria, in which case we can treat it with antibiotics. But you can get pink eye from a virus, in which case antibiotics aren't going to do anything.
Or like allergies.
You can get a pink eye from allergies. You can get a pink eye from dryness. You can get a pink eye from inflammation. So when someone just says, I have pink eye, I use the polysporin eye drops, that isn't necessarily the treatment that's needed or the best treatment either.
Right.
And those are common in kids too.
Okay. So I have 2 that I want to ask you about. Cross eye.
Cross eye is an eye turn.
Both eyes.
Well,
like
one eye crossed relative to the other.
Yes. But do you see it where like, okay, so a couple of years ago, a long time. Okay. Full disclosure. Looking back, it was insensitive. But at the time, we didn't know. We did this really cute campaign for Christmas where everybody made funny faces and they wore a Christmas sweater.
Yeah.
And a couple people chose to do like a cross-eye thing. And we got a bit of blowback from people saying like, this is a really stigmatized condition and that's really insensitive. So is it common to see people that have, I guess it would be 2 wandering eyes?
When we think about a wandering eye, there always has to be an eye that's looking at something and an eye that's not. So it's usually one relative to the other.
Okay.
But when we're talking about crossed eyes, you're just talking about people who are able to
look at their...
And that eye motion is called convergence. So essentially just people turning their eyes inward to look at their nose.
So it's not a condition?
It's not it's a normal thing that our eyes are supposed to be able to do. Like when we look at something up close, our eyes are supposed to cross.
Right.
But I can see how someone might think that that's making fun of people who have one eye who are crossed, who might not be able to control it. Perhaps that was what they meant.
Anyway, we learned a lesson. It was good. It was actually really good. We're humble. Okay. And then the other thing is I just learned on the TikTok, which I don't actually have TikTok, so I get it on Instagram as a Reels. Yep. That like 50% of men are color blind. Is that a thing?
I'm
just
not
TikTok
sure.
Making stuff up.
I'm not sure if that statistic is correct. I don't know if it's 50%. That seems like a little high. I'm not sure what the actual number is, but
like more of men would be colorblind than women. And do they know?
The most common type of color blindness is red-green color blindness, and it's X-linked, meaning it's a condition that's on the X chromosome. And so if you have, like in women would have to have 2 X chromosomes that are both have the condition in order to get it, whereas men only need one X chromosome to have it. So that's why it's a lot more common in men.
Got it.
But the type of color blindness, red-green color blindness, essentially it's not necessarily that you don't see color. It's just that you don't see as much of the color as you would think.
Got it. It's not as saturated.
Correct. So think about someone, and you can be red weak or you can be green weak, meaning you see things with slightly less red in them or you see things with slightly less green in them. So like if we're just taking a random object that's a color and you said, okay, well, let's take the red out of this, but not all of it, just a little bit of red out of it. What would it look like? So like, it's almost like playing with paints as a kid and you're trying to think of, if I mixed this color and then I mixed it with less red, how would it look?
Right.
And so that's essentially what color blindness is. And you can have moderate, like medium, severe red-green color blindness.
Okay.
So there's probably...
They're not seeing the world in black and white though.
Definitely not. No.
Okay.
They're just seeing the world a little less red or a little less green
than
how
like,
we would see it.
You wouldn't even really... I always think about that. Like I sort of like trip out on my own thoughts sometimes. Like I see that as blue, but is my blue the same as your blue?
No, probably not either.
Yeah. So oh my gosh, we could totally go on. Jason's being so mean today. There is no way. We only have a few minutes left. So I'm gonna go
rapid fire
right into post-concussion. Because as I mentioned, I have a son who plays a high contact sport. And concussion is always a part of the conversation. You've kind of mentioned why you got into the concussion space. And another stat I found, up to 70% of people with concussions experience visual issues. Why do you think these symptoms are overlooked?
I think there's a few reasons. This is a tough question. After concussion, like right away after concussion, usually people are complaining of light sensitivity, headaches. They might have like their aches and pains in their neck, those types of things. But after a few weeks, a lot of the time it subsides. So a lot of times it's just, you recovered from your concussion, you took your rest, you maybe did some physio, and now you're okay. But some visual things can linger, but we don't necessarily put priority on them because we don't realize what they are. We don't check those types of systems. So remember I said slouchy eye posture and the inability for our eyes to cross, essentially, happens a lot after a concussion. So like instead of me, I was able to converge, I was able to turn my eyes in really easily to read, no double vision prior to my concussion. I get hit, now my eye posture is really slouchy. My system now has to do so much work to try and turn them in, and it can't because it doesn't have the stamina to do it. That's really difficult to explain to someone.
Yeah.
Like that is so hard to say. Like sometimes when I read, it's fine. And sometimes when I read, it moves a little, but it's still clear because there's nothing wrong with the clarity of my eyes. But it's a coordination problem. And most optometrists are also not trained in that area. So I did that whole extra year trying to get all this additional training. So I measure all of these things, such as the stamina of how much someone is able to tolerate their eye posture. But those things are not measured in a routine exam. In a routine exam, we're really focused on, can you see clearly? Do you have any health problems in your eyes? Is there anything seriously bothering you? No? Okay. So we're not measuring those things. And so I even see people who like tell me I've already gone to the optometrist. They said nothing was wrong. And then I find a focusing problem and a slouchy eye posture and something that I could train. And I wish I would have seen them 2 years ago.
Right. So do these conditions persist even if maybe some of the acute symptoms of the traumatic brain injury are?
Yeah, they definitely can. Yeah. So, and there's not really a way of telling for certain when it's going to persist and when it's not.
Sort of like, it sounds like how you're describing it, a bit insidious because you don't really, like they're nuanced, so you don't really necessarily notice it.
Definitely.
And until somebody validates and says, oh, have you been experiencing this? And you're like, oh, actually I have.
Yeah. Or sometimes it's really hard to describe because it's something that's very strange that's happening.
Right. Yeah. Right.
And again, there's a funding problem. Like these types of assessments where we measure the stamina and the focusing ability and those types of things have very little coverage. Any rehab program that we do has very little coverage. And there's different types of providers that do these things in different ways. And some are a little bit more evidence-based than others. And so that also creates a little bit of a stigma of it because nobody wants to go and be told they're a great candidate, spend a lot of money, and then unfortunately not have the outcome that they were looking at. Yeah. And so I think all of those factors put together, like how hard it is to diagnose, the stigma between are you going to go to someone who's doing it properly? Did you get assessed appropriately afterwards? And don't even get me started on like insurance involvement. If it's like a car accident, gets completely out of hand. So it's very difficult to circle.
Well, and I think sometimes we have to, we deal with this all the time, particularly in these conversations on this podcast, because like we're talking about healthcare, and there's a system. There's a system in Canada, and there's not much we can do as individuals. Maybe everybody vote, but like we're a federal election right now. But like other than that, like there's not a whole lot we can do to have agency on how that system goes. I think the way I look at it is explained to me. We do talk to a lot of clinicians who provide incredibly vital services that are outside the system. And we spend, we make choices every day where we want to spend our money. And this is not a judgment call or anything. For sure. But as you've said, our eyes are one of the most important conduits to life, like being able to see, being able to read, being able to look at people and connect to people, look at them in the eye. Like, I just don't know. Again, and I'm not mitigating the real financial pressure that people are under. But that's a pretty valuable asset to have, I think.
Definitely.
In terms of your wealth.
Yeah. And that's why we have like our not-for-profit. That's what my mom is also a teacher.
Yeah. Okay. So tell me
we're very passionate about education. And so that's where I spend a lot of my time, even like, that's why I'm so happy to be here. I'm clinical faculty for UBC. I teach the family medicine residents about eye care, primary care, eye care in our community so that they know more about those things. And we have this not-for-profit, We See BC Foundation, which is trying to fill the gaps for people anywhere in BC who need glasses because there's no coverage for that either. Or like any sort of rehabilitation, or we do low vision devices for seniors, for example, who need magnifiers or extra supports at home, who might not be able to afford it. Because there are some programs out there, but sometimes they're limited and they're trapped. And there's so many people who fall in the middle, who need our help. So we're always looking for donations for that as well.
Amazing.
If anyone's really generous and listening and this really spoke to them.
Yeah. And where can people find more information about that foundation and even just your optometry?
Yeah, we're here in Kelowna. We're called ABC Optometry and Vision Therapy. So anyone is welcome there, or if you have any questions, come on by. And then WeCBC Foundation is the name of our foundation. You can just go to wecbc.ca for more information on that.
There's lots of great information. I have to say that we're probably going to have you back because you're such a great guest. You've really done a lot to give us a very fulsome introduction to optometry. And I realize now that there's so much there that we've kind of barely gotten into kind of some of the more nuanced parts of the conversation.
Definitely.
And I would love to go further with that, particularly maybe a specific episode on the concussion stuff, also the pediatric optometry. Super, super interesting. But thank you so much for like giving us that, 10,000 foot introduction to optometry. Yeah. Super valuable. I just have to tell our audience, I first came across you. You're such an impressive person.
Well, thank you.
Pump your tires a little bit here, but you were a nominee for, what was it? Rising Star award.
It was like new business.
Yeah, Rising Star New Business Award for the Kelowna Chamber of Commerce. And they did these short little video vignettes, and yours was, and they're so short, like you can't even really be compelling, but yours was so compelling.
Thank you so much.
Yeah, and I was just so impressed. And no shade to the one that actually received that award, but I thought you definitely were deserving, and I'm so happy to be able to give you a platform to talk about your work.
Thank you. I appreciate it.
I kind of want to just jump a little bit to kind of a more personal side.
Okay.
Sophia. Of course, this podcast is about health and healthcare, and the whole idea behind Wealthy is that our health is our wealth, right? And if we don't have it, then we have nothing, right? And so health also sort of encompasses a lot.
Definitely.
How do you think your definition of health or healthcare has changed over the years?
Cool. That's a very loaded question. A very good question.
We ask everybody.
You ask
if it makes you
everyone,
feel better.
I think that where I love to see healthcare is in a prevention aspect. So turning away from reactive medicine and more into preventative medicine. So instead of treating a disease, fix it before we even get it. And I think we're getting there, especially like coming from the East, moving to Kelowna. Like I loved it here because there's so many active people. Like there's so many people outside. There's so many people who love to be like active. And we know that, moving around and being physical is so great for our health. And so it's so like my perspective on health, even coming here, I was like, I feel like mentally I'm so much happier. Mm-hmm. And physically it's so easy to do things here. And that really inspires me. Like when I see like people who are 90 who look like they're 65. Mm-hmm. And what is your secret to staying healthier, to having all of your wits and not even walking with a cane when you come in? And so that inspires me to go out and to try and educate about how we can be preventative in our eye care, and how we can then support everyone from kids with hidden glasses prescriptions to seniors who have macular degeneration and need a device, to help people function better and live longer and enjoy their life longer. Because essentially it's the point of health, right? It's to live as long as we can, but to live as full as we can for as long as we can.
Totally.
And a lot of the people who lose aspects of their vision that we don't realize are important, like our 3D vision, our depth, our balance, not being able to go for a hike anymore because you're tripping over yourself, impacts people in ways that we don't realize. So if we can rehab those things, if we can find those things, identify them first, Like we're helping so many people live longer and be happy while they're alive longer. That's the goal.
I love it. I totally do. I think it's so true. What area or areas of your life do you feel like you're especially wealthy or abundant?
Oh, that's also a really good question. I think in relationships are very important, and the relationships we have with other people, and coming from like being an outsider, coming to Kelowna and feeling how welcoming so many people have been here, is amazing. I have like an awesome partner. We have so many like friends. I play so many sports with so many different people. I feel like that is what keeps me going. I guess I'm like an extrovert, so like I thrive when I have like a ton of people to talk to all the time. But that's how I go out and I choose to connect with my community, is through like communicating with people, talking with people, anyone who'll listen, really. And that's how I feel like I keep my health strong.
Yeah. You have great energy, really. It's no surprise that you're an extrovert. So just to wrap things up, this has been a wonderful, amazing, eye-opening conversation. I know I kept saying I see, and then I was like, oh
I didn't notice.
But it's so important. If you could leave our listeners with one message about eye care, eye health, optometry, what would it be?
Don't take your sight for granted. Even if you think everything is okay, confirm that you know everything is okay, because we have access to so much in this country. Like we're so fortunate to have so many people with so much knowledge who can find things early, detect them, help you make better decisions for yourself. But all you have to do is get there. Like you have to put yourself in a place to let us help you. And so go do it. Meet someone new in your community who might be able to help you and give you something like a new perspective. Because it might change your life. It might change the way you see things in the future. Your outlook can definitely change.
Okay. And so, do you see everybody, or are you specifically just kids and post?
I choose myself to limit who I see, just because I enjoy feeding off of the energy of the best little kids ever.
I can totally see that.
Yeah, we have so much fun. I always say I smile way more than the average person at work. So I choose to limit who I see to just kids, so anyone under the age of 18 for any problem, and then adults if they have like any sort of post-concussion symptoms, double vision, weird things with their glasses that no one can seem to figure out, like any sort of weird problem-solving case.
The weird ones.
The weird ones is what I enjoy the most, because I like the problem-solving aspect. It's like, let's try and figure this out. And sometimes it takes longer. It takes a little bit more testing, but we usually get to the bottom of it. And then adults who have low vision. And I will see any adult if they have like diverse needs or like nonverbal or anything like that, just because they deserve good care too.
Amazing.
Yeah, there's other clinicians at my office who will see like the general population who are awesome.
Just like the people like me. They're just old,
well,
blurry.
You still matter too.
Thank you. Thank you, Dr. Sophia. This has been awesome. You are such a gift to our community. Thank you, for moving out west. And I hope that the mountains and the lake and the birds and this beautiful community continue to hold you with great care, because you are providing such an invaluable service to our community.
Thank you.
And
I really appreciate it.
It's just always so refreshing to speak to somebody who has such a passion and an energy in their career. I think that you're going to change the world.
Oh,
I love it.
Thank you so much.
Thanks
lovely.
for coming. We'll have you back for sure.
That'd be awesome.